The AI triage tool had been live for 6 weeks when Dr. Mina called the emergency meeting. Not a clinical emergency, but an operational one. The tool was flagging 43% of Tuesday's patients as urgent. So Dr. Mina pulled up a spreadsheet, turned his laptop toward the room, and we don't have a 43% urgency rate. Something is wrong with the tool. Felix looked at the spreadsheet. Then he looked at Nadia. Nadia looked at her coffee. Nobody spoke for about 5 seconds, which in a meeting with Dr. Mina feels like a geological age. The model wasn't broken, but what was actually wrong would take Dr. Mina the better part of a month to accept. And the fix would have nothing to do with the algorithm. If you've been following along, you know this man. He built his practice from nothing. He's brilliant clinically. He memorizes every patient's name and their kids' names, and he's absolutely incapable of choosing one priority when he can ask for 3. He'd approved the triage AI with 3 goals, stated in the same meeting with the same enthusiasm, as if they were naturally compatible. 1, flag every patient who might need urgent attention. Miss nothing. 2, reduce unnecessary escalations that were clogging the schedule. Fewer false alarms. And 3, keep the system fast enough that the front desk processing time did not increase. Fast, thorough, lean, all at once. And here's the thing that most people get wrong about AI failures in healthcare. When the tool produces strange results, the first instinct is to blame the tool or the model, retrain it, adjust the parameters, call the vendor. But in a surprising number of cases, the model is doing exactly what it was told to do. The problem is that nobody agreed on what it should have been told, and that's what happened here. So Dr. Mina had said yes to all 3 goals because each one sounded reasonable on its own, and they were separately. But Felix sat down to configure the model and hit a wall that Dr. Mina did not know existed. You cannot optimize for miss nothing and fewer escalations all at the same time. Those 2 goals pull in opposite directions. Widening the net to catch every possible urgent case means more flags, means more escalations, more load on the schedule. Narrowing the net to reduce false positives means you will by definition miss some cases. That's math. Felix asked Dr. Mina which one to prioritize, and Dr. Mina said, both. Felix told him, well, the system cannot do both. All right? Dr. Mina, being who he is, said, figure it out. So Felix figured it out. He split the difference. The model would flag aggressively on symptoms tied to the top 5 high-risk conditions and use lighter threshold for everything else. It was a reasonable compromise. It was also a compromise that nobody had formally approved because nobody had formally acknowledged that a trade-off existed. And that compromise was the direct cause of the 43% flag rate. 2 of those 5 high-risk conditions covered roughly a third of the patient population. The model wasn't being paranoid. It was doing exactly what the real rules told it to do. The rules just carried a contradiction that Felix had papered over as best as he could. So the model executed a compromise it was forced to hold. But here's a deeper question. Where was this compromise or contradiction before the AI showed up? The answer is it was there all the time. Somebody was just absorbing it, right? Before the AI, humans were managing these trade-offs every single day. They just didn't call it that. Nadia predictably had been doing this all along. She kept a mental list of the patients who frequently called with minor complaints. She knew which providers ran behind and quietly adjusted the urgency threshold based on who was on shift. She had an unwritten rule. If the schedule was more than 80% full, anything ambiguous got pushed to the next day. If there was room, it got squeezed in. None of that was in a policy document. None of it had been approved by anyone. It lived in Nadia's head and in the heads of the 3 receptionists who learned her system by watching her for a year and a half. And here's the key insight. Human operators can carry contradiction through discretion. A receptionist can be thorough on one call and fast on the next. She can tighten the threshold when the schedule is packed and loosen it when there's room. She negotiates competing demands in real time without anyone having to write down the rules for how she decides. The AI could not do that. It needed consistent rules. At the moment you try to formalize rules for decisions that were previously made by feel, you discover that the rules contradict each other. The AI did not create contradiction. It just removed the ability to ignore it. So here's the answer to why the model is not the problem. What looks like a model failure is usually a governance failure, a process failure, a prioritization failure. The model gets asked to reconcile contradictions that the operating model around it never resolve. And this pattern shows up everywhere once you know what to look for. Standardization versus flexibility. One system-wide triage rule versus adaptation to the Tuesday afternoon rush. When Dr. Ade's patients stack up, speed versus diligence, faster front desk processing versus deeper checking when something looks borderline. You also have autonomy versus oversight, letting the system run versus having a human review every flag it produces. Each pair of demands is reasonable. Each pair, when pushed to its logical endpoint, breaks the other. And before the AI, Nadia was the shock absorber. She held both ends of every contradiction every day, and nobody noticed because the system never had to declare which side it was on. The harder leadership tries to promise everything at once, fast and thorough, standardized and flexible, autonomous and fully controlled, the more brittle the deployment becomes. A workflow designed around incompatible promises is unstable. It doesn't matter how good the model is, right? So back to the 90-minute meeting. Felix walked through the configuration. Nadia explained the exceptions. And somewhere around minute 40, something shifted. Dr. Mina went quiet. Which, if you know Dr. Mina, that is unusual. The man has an opinion about the angle of chairs in the waiting room. And then he said, so you're telling me tool is not making bad decisions. It's making the decisions I asked it to make. And the decisions I asked it to make don't work together. Felix nodded. Nadia's coffee had gone cold 20 minutes ago. And then Dr. Mina did something unusual. He made a choice. He sat down with Felix and Nadia and ranked the priorities. Patient first. The system flags aggressively for the 5 high-risk conditions, and that flag rate is acceptable. They would rather overflag than miss. And then efficiency second. For everything outside those 5 conditions, the threshold tightens to reduce false positives. And then speed. If processing time goes up slightly on complex cases, that's the cost of getting the first 2 right. The ranking wasn't elegant. It was not the perfect solution. Right? But it was a decision. And the moment the system had a clear hierarchy of priorities, instead of 3 competing ones, the output stabilized. False positives on non-critical conditions dropped. Right? Nadia's exception queue got much shorter. The front desk stopped calling Felix every afternoon, and Dr. Mina stopped checking the flagging spreadsheet obsessively, which meant he showed up to his the afternoon patients slightly less distracted, though he'd never admit the spreadsheet had been the problem. He told himself he'd only checked it twice a day. His browser history said otherwise. Here's the moment from that meeting, which I promised at the top, the part that stuck. After 90 minutes, after the walkthrough and the data and the long silence, Nadia said something that changed the room. I've been managing these trade-offs manually for 4 years. The AI did not create the problem. It just could not do what I do, which is pretend both sides can win at the same time. Dr. Mina looked at her, then at Felix. Then he said something that in 2 years of working together, neither of them had heard before. Tell me what else I haven't decided. Nadia opened her notebook. It was a long list. So the question is not why did the model fail? The question is what contradiction is it being asked to hold together? If your AI deployment is producing inconsistent results, the model may not be the issue. The operating model around it might be carrying contradictions that nobody has named. The tool is just a place where those unresolved choices finally become visible.